I have the first question about BioRad. I want to know the nature of the company and which particular product sector are you active?
Absolutely. So first, good morning. So BioRad, we are world leader in two areas. First of all, in the life science research, because historically speaking, BioRad was a company that was founded to serve life science research. So we are one of the world leader in producing instruments and reagents for research in biology. So for instance, we are number 1 or 2 in PCR, the molecular testing. So we are making instruments and reagents for PCR and lots of other reagents for research. And the second half of the company is dedicated to diagnostics, which means that we are making assays for clinical diagnostics for the healthcare people, for the hospitals. So for instance, we are very strong in the infectious disease domain. We were one of the first company to launch HIV test, for instance. We have been also the world leader for the testing of the mad cow disease back in 2000, if you remember that crisis. And we are also very strong in diabetes. We are strong in immunohematology area, blood testing. So throughout the diagnostic space, we are making a lot of good products to test in the hospitals and the private clinical labs.
Okay. But when was born BioRad?
BioRad was founded in 1952. It's a Californian company. We are based in close to San Francisco. And that the company was founded by 2 researchers at the time. And then BioRad was during most part of this life was a life science company, and then it acquired Sanofi Pasteur Diagnostic, which was a French company dedicated to diagnostic, which historically speaking is very linked to the Institut Pasteur. So which is why we are very strong in infectious disease. And that was in 1999. And since then, we have been, half life science research, half diagnostic company.
But in how many countries we are present?
We are present worldwide. So the company is from the United States, of course. But in terms of diagnostics, we are very much present in Europe. The main part of its R&D, for instance, it's in Europe. We are present for R&D. We are present in France. We are present in Switzerland. We are present in Germany. And regarding our commercial activities, we are covering the world. So we are selling worldwide in every single country of the world. BioRad is selling products.
Okay, perfect. Now I want to speak about the Platelia test. What goals you have set yourself in the production of this new test?
All right. So first off, what is the test? So the test, it's a serological assay. It means that it tests for the presence of antibodies against the virus. So it's a very good assay to give you an evidence that you were infected by the virus. So it really allows you to follow the epidemic throughout the population. So if you have, or have had symptoms of the disease and you like to know whether you've been infected and you've been recovering from the virus, you can use that kind of test, which will tell you that you have antibodies against the virus. So the idea is really to use this kind of tests throughout the population that were in contact with the virus to get a good idea of who has been infected by the virus. So in terms of population, it gives you a very good idea of the prevalency of the virus, how many people were infected. And in terms of local at-risk populations, it's like healthcare workers, for instance, or students in the school. It's a very useful tool to follow the dynamics of the virus. So to get that, you need to have a very good assay, and I believe this is the case of our assay. It must be very sensitive, so it detects all kind of all people that were infected, so no false negative. And also it has to be very specific, because you know that there are other coronaviruses out there. There are also respiratory viruses, which are not coronaviruses, but which gives you the same kind of symptoms. So you want to make sure that what you are detecting is the SARS-CoV-2 and not another antibodies raised against another viruses. And that's the case with our assay, which has a very high specificity. And this is something which is demanded by the health agency, like the FDA. If you want to get the CE mark in Europe, you need to prove that your tests have very high performances, and that's the case of our assay that was registered by the FDA and which got the CE mark also very early on.
But there is some risk of false positive or negatives?
No, there is no risk of false positives. I mean that the test is really close to 100% specific. It means that, you know, if you get a positive result, you are sure that this is COVID, that's the SARS-CoV-2. So, and this is something which is really very important with the COVID, and this is really a strong demand from the health agencies to have very high specificity, and that's the case of our test. In terms of the sensitivity, so false positives, so that really depends on how you are using the test. You know that this kind of tests, serological testing, they are measuring the amount of antibodies that are raised against the virus. So the immune response takes a few days to build up. So when you get symptoms, if you test the very same day, for instance, then you will be negative. You'll be negative because you don't have antibodies yet. Okay, but after a few days, the immune response is building, and then you get positive. So with our assays, we have run clinical assays following people who were infected, who got symptoms, and we were followed in the hospitals. So we did that study in French hospitals, in 3 hospitals in Paris. And we have followed a cohort, a group of people who were infected. And we know that we can detect them after 4 to 5 days. And this is really due to the fact that our test is very sensitive, because it detects all antibodies against the virus, not only one type, but all kind of antibodies. So that makes it very sensitive. So after 4 to 5 days, you start detecting the people. And after 8 days, the sensitivity is 100%. So everyone that has been infected, after 1 day post-symptoms, you'd get a positive result with that assay.
Okay. And other product you are working on?
Yes, indeed. we are working on other product, but I cannot disclose at that time exactly what we are working. But you know, there are a lot of discussion regarding the immune status of people. So there is a strong demand for tests that guarantees you that you are immunized against the virus. So we are looking out to this kind of assays, for instance, that would nicely complement our range of products. We have PCR product, we have digital PCR product, which is something very new and very specific to BioRad. We have the serological assay that allows to follow the dynamic of the virus. And now we are looking to other assay that would complement that one. Also depending on the demand from the public, of course.
Okay. The last question. There are some collaboration in this moment with some hospital or university in Italy?
Yes. Oh, you mean with us, with our test specifically? At this moment, we are more our test has been distributed throughout Europe, so it is evaluated in many countries, including Italy. So we have customers evaluating the assay in Italy because there are many assays. Some are good, some are not. So of course, you want to evaluate them. So yes, indeed, in Italy, We have people evaluating the products. And in terms of collaboration, right now we are more collaborating with French hospitals, but we have contact in Italy, and that's something that we could do. If there is a good opportunity, we could indeed collaborate in Italy as well.
Ah, okay, perfect. Thank you very much for your time.
No, thank you for your time.
Okay.
I appreciate very much. Thank you.